we have children who may not have had reached the threshold in terms of hip surgery, or maybe didn't suffer from hip dysplasia in the first place, having potentially operations carried out on themselves. Currently in the audit over the last 2 years, there's about 561 people have been included in that particular audit. But if the audit is going back 15 years, on those terms, we could be talking about thousands of parents and children who will be part of this particular audit. I myself had to leave a son in an operating theatre for a procedure not as serious as the ones that we're talking about at the moment, but I saw the fear in his eyes before I left the theatre, and I also felt very difficult in leaving that location. But you can imagine the fury that must exist amongst the thousands of parents who left their children in very difficult circumstances, in a situation where potentially those operations were not necessary, where potentially those operations could have damaged those individual children. All operations have challenges. Infections are possible. Surgical trauma is possible. You know, it's a very serious issue putting a young child under an anaesthetic in this country. Now, today, potentially thousands of parents have been left in limbo, and for many, there is an excruciating absence of information. And this is the real difficulty for them. The questions they want to know is, how did this happen? How can hospitals carry out a particular operation at a rate of 5 to 10 times more than the population of that country needs? And nobody seemed to be able to pick up on it. What are the government structures that allowed this? Where is the leadership in the particular hospitals that this happened? What is the culture that facilitates this? And where was the CHI and Ministers for Health over those 15 years? The Department of Health are responsible for all those aspects of our health services. You know, the idea that, we are asking parents to be confident today Deputy. In relation to what's happening to their children today, yet we cannot tell them what happened for the last 15 years to the children. And if the idea of this audit Deputy. Is to try and make sure that this never happens again, surely there's an urgency to make sure that that audit is complete ASAP. When will parents know what happened to the children?
The audit is not going back 15 years. The audit that's currently being conducted is a random anonymised sample of patients aged 1 to 7 years from 2021 to 2023. Now, letters have issued from CHI and CAPA to parents